So this is week number 3 post medial patellar luxation surgery with Hank, and we are at Hank's very first physical therapy session, first of 9 actually. I signed him up for a series and I'm very excited about it. His first session we learned a ton. It was 2 hours. I caught this quick little segment of him on the treadmill, and that's about it that I had time to do in our actual therapy session. It was pretty hands-on, and I would highly recommend finding a physical therapist for your dog after this type of surgery. It is absolutely amazing, and we have some great take-home exercises to do each week. And what you're seeing here is just a nice gentle little massage. I start at his head, and I will gently work my way down through his shoulder girdle, through his ribs, and all the way down to his hips, back, and legs. I typically start at his head just to kind of wind him down and put him in that, slow, relaxed energy, so that when I get to his left leg, which is the one we had surgery on, he's already kind of relaxed and willing to, take the massage a little bit better. And we do this a couple times a day. So I like to, at least 3 times a day, I try to get this massage in. Sometimes I'll use heat. I'll put a heat pack on his low back, pelvis, and legs before we get started. And I've edited out a lot here in this video just because I'm sure you don't want to watch 15 minutes of just a dog getting massaged. But I start on his good leg, and passive range of motion is one of the exercises. So as you can see, I'm just slowly kind of rubbing his hip, back, and leg area, and my right hand is on the underneath side of his leg, so that when he allows me to stretch it out, he's supported with my hand underneath there. And I don't pull against him. If he resists, I let him just kind of tuck his knee back in. He's pretty tight in his hip flexors, quads, and whatnot, as you can see where my hand is running. I'm trying to stretch that top muscle out so that he can straighten and stretch his leg towards me. And when he starts to resist, I just let go. I never pull, right? And if I feel that he's way too tight and just not taking it at that time, I'll just walk away and we'll try it again another time. And like I said, heat always works. So if you put a little heat pack on before and, get his muscles relaxed, get his energy down, it seems to work really well. And you can see as I, kind of massage that muscle, his leg kind of straightens and then it pulls right back in. Here you go. That's a nice little stretch right there. And then eventually, after I'm done with, his good leg, I'll flip him over and we will start to massage his leg that he had surgery on, but we just take our time with that side. And see, as you can see here, I'm straightening that leg and trying to pull it just for a little baby stretch. And once he resists, I will let go, just as you can see. Yeah. So on to the other side, I start all over, starting at his head and his ears and neck, working down to the rib cage, down to his low back, his hips, and his legs. And I just make the pressure a lot less on his surgery leg, his left leg. And, I'll read your dog. And if they, are a little bit jumpy or a little bit hesitant on the pressure, just go a little bit lighter and maybe just start with the petting. And over time, you can maybe get a little bit firmer with that massage depending on their comfort level. And again, I have my left hand underneath his leg just to support it so that if he does stretch his leg towards me, which is what we're after with that passive range of motion, if he does stretch it towards me, he's supported and in a good alignment. So I just kind of have my hand there just ready and waiting for him to relax and stretch it out. And like I said, sometimes this takes about 15 minutes to 20 minutes, and I like to get this in at least 3 times a day. And sometimes he's really relaxed and he allows that stretch, and other times, he just hugs that knee right into his belly the whole time. So, and when we go into the physical therapy sessions, they actually, really dig in there and do some deep tissue, some fascia release. It's almost like a pressure point massage or a trigger point massage, which is amazing. After they do that with him, he gets up and he's a ton straighter. He walks so much, more easeful and aligned. It's amazing what they can do at his physical therapy session. So again, kudos to the physical therapist that I'm seeing. I would highly recommend spending the time and the money on therapy after your dog's surgery. It's just amazing the difference that I see after an hour and a half each week. Some of the exercises that we're learning in therapy are almost a little bit tailored towards the agility exercises. And Hank has never been into agility. We've tried a couple things in his puppy classes when he was younger, and he did not take well to any of that agility training. And so I'm actually very happy with his progress here. I have an umbrella on the floor. You can use anything from a broomstick, that you can kind of put up on a couple of shoes or a couple of socks to give it a little bit of a lift, maybe an inch or two. And I'm just, with a treat, bringing him across the umbrella slowly, 1 foot at a time. So similar to the pool, if you remember in the beginning of this video when he had to walk in the pool, we filled the water just up to the mid-knee so that he would have to step up and over the water to keep walking on the treadmill. It's kind of similar to if you were to walk in a shallow pool, you don't just shuffle your feet on the bottom, you actually pick your foot up and step it out of the water to walk forward. So same thing here. And so we don't have a pool, obviously, so we're using this little umbrella to walk over with each limb and see how he gets that full range of motion, bending his knee and lifting it up and over. I really like this exercise, and he seems to like it quite well too. And I have to slow him down so that he doesn't hop, right? So sometimes he'll just take both back legs and hop over. Here's just a stick that I have perched up on 2 socks on either end, and it's kind of hard to see because that stick matches the rugs that I have laid down for him. But I thought I would give you, just a different view to watch this exercise. And like I said, you just got to kind of hold the treat at his nose, but don't let him get it so quick because you have to slow him down with that treat as well so they don't just run or hop over. So then there's another exercise called a stair stand, and basically it's just standing his 2 front feet on the very first stair and holding him there. And I don't want to put him on our stairs, our full flight of stairs, afraid that he would just run all the way up. So I found a little Rubbermaid plastic bucket, tipped it upside down, and he just put his front feet on. Basically the basis of this exercise is to get him to shift his weight to his back legs. And so with his feet perched up on a little bucket, it transfers the weight to his 2 back legs. And he is more in his right leg, but we'll work on this. And basically I just hold the treat above his head so that he has to look up, because if the dog is looking down at the floor, the weight goes into the front legs. If the dog is looking up, the weight transfers back to his back legs. And this is all stuff that I learned in the rehab sessions, which is some great knowledge. And so that when we're going for walks too, I make him look up, so that when he's walking, the weight is in his back legs as well. So just little tidbits that I have taken from our sessions. You can see here that he's very much still in his right leg. His whole body is swayed to the right. But this is just week 3, and it's our first week with these rehab exercises, and I expect Hank to just really excel at all of these. Here we're doing a sit to stand, and Hank, knew how to sit and stand before the surgery, which is really important that they know these commands before going into it so that when they come out of surgery, they know exactly what you want them to do. So I'm having him sit squarely. Sometimes his little leg goes out or he tucks his hips under. And then I have him standing. The goal is for him not to walk forward with the stand, which is easier said than done. But you want them to stand so that they put the weight in their back legs. So I'll show you here. So you just kind of have to stand in front of them so they have nowhere to go. He kind of swivels around a lot though. So here's a sit, and that left leg wants to jet out, but he's doing pretty good. And there we go. So see how when he stands up, it's kind of like humans squatting down and up. It's like just a standing squat for us, but it's a sit to stand for them. And it just strengthens the muscles in the back side of their body, their hamstrings, glutes, thighs. And here what I'm doing is just another exercise to transfer the weight to his left leg. So if you hold the dog, support underneath their belly and underneath their rib cage so that not all the weight is going to go in their hind legs. And you take your hand, cup your hand, and put their good foot, their good paw, into your hand. And you're going to notice there's going to be a lot of weight into your hand. And Hank is basically putting 99% of his weight into my hand. So if you tuck his toes under, so I kind of round his toes under, just doing that kind of sends feedback back to the brain that he has to stand into his left foot. I'm going to let him shake it off, and we're going to try that again here with his left leg now facing the camera so you can see from this angle. My hand again is supporting underneath his ribs, his belly, and his pelvis. And, you know, I square him off. I try to pick up that right foot slowly. You can see he just picks up his left leg completely. He's pretty much standing in my hand completely, but see how I tuck his toes under? Okay, so this isn't working yet. So we're just going to switch things up. We'll come back to that. So here I'm still going to work on that weight transfer. I'm going to square him off with his two front legs and back legs. He's kind of a little wiggle worm. And I'm going to put my hands on his hips, both sides, and just sway, slowly rock from side to side. Again, he's not letting me rock him too much to the left, but that's the goal. And in time, we'll get a little bit further, I'm sure. But just supporting him with my hands, rocking him from side to side. Most of his weight is in his shoulders and arms, so I'm going to move my hands up a little bit so that my hands support his shoulder girdle and my elbows support his hips, and I'm going to rock his entire body. So he has to transfer weight in the front legs as well and in the back legs, and here he goes. He lets me know when he's done. I'm going to get back to that limb lift again, that last exercise, see if he takes it a little bit better. Again, I'm really supporting underneath his belly. I'm supporting him with my right hand and his right foot, tucking his toes under so he has to put weight into that left leg. And I'm holding him a lot here, so he doesn't have a ton of weight in that left leg. We'll get better as we go. Yeah, that was really nice. And so the passive range of motion can be done when he's lying down, like you saw when I was giving him a massage, and it can also be done when he's standing. This isn't his favorite exercise, but basically I'm trying to get him to stretch his hip flexor, and he's doing pretty well there. But you know, there he goes. He'll let you know when he's had enough of a stretch. But I'm not pulling too much, and it looks like I am, but I'm really not. I'm slowly just kind of moving his leg back, and if he moves it back with me, I keep going. The minute he resists, I let go, and I just kind of let him shake it out. So that's a good group of exercises that we're doing every day, multiple times a day, and sometimes we have success and sometimes he's just not into it and we will, you know, walk it off and come back to it later. One little piece of advice I would give is the very first 2 weeks post-surgery, keep the cone on the entire time. We had a little setback. He is pretty smart at getting his cones off, and he did get his cone off and licked his incision. And there was one spot on there that he licked it raw, and so we had to bring him in on a Saturday morning to get it cleaned out. We couldn't resuture, but we just cleaned it out. We put him back on an antibiotic, back on a pain med, which I wasn't too happy about, but it kind of set us back a little bit. So my advice this week from this video would be keep the cone on until everything is healed. There's no scab, there's no open wound, and there's nothing to lick. It's hard to see in this picture, but you know, from the naked eye looking at this open incision, it's almost as if we can see something shiny metal, like a piece of hardware or pin, which we are going to take a look at next week. And so I will keep you posted on that as well. Other than that, we are very happy with Hank's success and his post-surgery thus far in 3 weeks. He is back to his routine bowel movements, back to drinking, back to eating, and his wiggly, happy self. So I hope that this video helps you as well or gives you some advice, and we will stay tuned for week number 4. Thanks. Bye-bye.